NAtalie Kunsman, MD, and today we are going to learn 3 ways to regulate calcium. So to talk about this, we are actually having a hormone discussion in disguise. So one of those key factors in regulating calcium comes from the parathyroid gland. Actually, it is 4 parathyroid glands, and they are 4 little glands that live right behind the bow tie section, so at each corner of the bow tie of that thyroid gland. Its sole job is to tightly regulate the amount of calcium in the bloodstream. And to talk about the parathyroid glands is essentially to talk about our calcium health, and vice versa. So calcium is stored in bones and needed for bony strength. But the ionized calcium in the bloodstream is what is needed for cellular electrical conduction across the cell membranes. The parathyroid glands make parathyroid hormone. If the circulating calcium levels are low, more PTH or parathyroid hormone is secreted. If those calcium levels are high, PTH slows down or stops. Calcium provides the electrical system for our nerves and muscles, allowing the nerves to conduct electricity and the muscles to contract. This is why the parathyroid disease, which might be an overproduction of PTH from a parathyroid tumor leading to high blood calcium, this is why it causes symptoms of the brain, muscles, and the bones. There are other causes of calcium deficiency, and it would be the parathyroid gland's job to help compensate and recognize that feedback loop with that lowered calcium. Now, there are risk factors for hyperparathyroidism, including being a woman over the age of 60, calcium and vitamin D deficiency, a history of radiation exposure or radiation therapy, genetic factors in a family history, kidney disease or failure or kidney failure, or taking the drug lithium or other medications such as phenytoin, phenobarb, rifampin, steroids, and other drugs that might be used to treat elevated calcium levels. Other causes of calcium dysregulation that the parathyroid gland may need to overcompensate for would be a pancreatitis, increased or lowered magnesium, hyperphosphatemia, septic shock, massive blood transfusions, kidney failure, or certain chemotherapy drugs. Now, severe symptoms of hypocalcemia, low calcium, would be confusion, memory loss, muscle spasms, numbness and tingling in the hands, feet, and the face, depression, hallucinations, muscle cramps, weak and brittle nails, and some easy fracturing of the bones or osteoporosis. So osteoporosis has a lot of causative factors. Calcium deficiencies can affect all other parts of the body, such as the nails and slower hair growth and some fragile, thin skin. And of course, there are some situations where we can have an overabundance of calcium. Now, calcium also plays a very important role in both neurotransmitter release and muscle contractions. So, calcium deficiencies can actually bring on seizures in otherwise healthy people. So that was the first reason, or the first way we help manage our calcium. The second is actually calcitonin. Calcitonin is a hormone. It's made from the parafollicular cells, known as the C cells, in the thyroid gland. And we often forget about this hormone, and we often forget where it is produced. So this calcitonin will oppose the effects of the parathyroid hormone. So it will act to increase blood calcium levels, and then calcitonin will lower blood calcium levels by suppressing some of the osteoclast activities in the bones and increasing the amount of calcium excreted in the blood. So whereas PTH will increase the calcium, calcitonin will lower the calcium so that there is an actual homeostasis and a balance. The third way that we manage our calcium is with vitamin D. Vitamin D is a big player in calcium homeostasis, and it will regulate calcium excretion. So if the parathyroid gland notices that vitamin D levels are low, it will secrete a lot of PTH to compensate. Well, how would you know if your parathyroid glands aren't working properly? Or how do we keep these parathyroid glands healthy? Well, you have to keep the thyroid gland healthy since they share a rich supply and they live in the same area. So if the thyroid gland gets destroyed or removed, there's a good chance that the parathyroid glands may go with it. Now, natural ways to keep your parathyroid healthy would be a good diet, no smoking, keeping good bony health in general to keep a good, decent calcium stores and calcium intake. Be careful of certain calcium lowering medications. Try to keep good calcium in the diet, and that can include anything from kefir to many organic vegetables that are high in it. We also need to keep foods that are high in magnesium, because don't forget, magnesium is one of those other cofactors needed to help this whole endocrine system keep the calcium in a reasonable, steady homeostasis. Foods that are high in magnesium include all the leafy greens, cocoa, avocado, bananas, some healthy fats, grass-fed meats, and fresh herbs and spices. So again, there you have it. The ways to manage your calcium, or the ways to manage 3 discrete yet interconnected endocrine and hormones required to keep the balance. Most of that balance is in this general area, which is where the manufacturing site is to recognize the calcium stores and balance the flow in our system. Again, I'm NAtalie Kunsman, MD. Subscribe to my channel below, and until we meet again, be well.